Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is August 26, 2025. This video is on a New England Journal of Medicine article published on August 20th, 2025, titled Overall Survival with Neoadjuvant Nivolumab plus Chemotherapy in Lung Cancer. There's an accompanying editorial titled Redefining Lung Cancer Therapy, a long-awaited shift in strategy. The study investigators evaluated neoadjuvant nivolumab plus chemotherapy in non-small cell lung cancer. It was an open-label phase 3 randomized controlled trial, 358 patients with stage 1B to 3A non-small cell lung cancer, randomized 1:1 to 3 cycles of neoadjuvant nivolumab plus platinum-based chemo versus chemo alone. It was a multi-center trial. There was underrepresentation of black patients. The primary endpoints: pathological complete response and event-free survival. Overall survival was a powered secondary endpoint. Stats: stratified log rank test, Cox model, Kaplan-Meier. Demographics: ECOG 0 to 1, no EGFR ALK mutations. Median follow-up 68.4 months. What did they find? 5-year overall survival 65.4% in the nivolumab plus chemo versus 55% in chemo alone. Hazard ratio 0.72, p-value 0.048. Event-free survival 49.2% versus 34.4%. Hazard ratio 0.68. There was reduced recurrence and metastasis. PCR impact: overall survival 95.3% with PCR versus 55.7% without. Circulating tumor DNA clearance: overall survival 75% versus 52.6% without clearance. Hazard ratio around 0.38. Limitations: small PD-L1 subgroups, underpowered for secondary analysis. Key takeaways: neoadjuvant nivolumab plus chemo offers durable survival benefit. PCR and circulating tumor DNA may serve as surrogate markers for long-term outcomes. The accompanying editorial said that this trial compared neoadjuvant nivolumab plus platinum chemo versus chemo alone in resectable non-small cell lung cancer stage 1B to 3A. 5-year overall survival 65.4% with nivolumab plus chemo versus 55% with chemo alone. PCR 95.3% survival versus 55.7% without. Biomarker insight: circulating tumor DNA clearance predicted superior overall survival 75% versus 52.6%. Editorial insight: this validates circulating tumor DNA and PCR as potential surrogate markers, supports shift to neoadjuvant immunotherapy. Implication: nivolumab plus chemo is now a approved neoadjuvant strategy, redefining non-small cell lung cancer therapeutic paradigm. Caution: no head-to-head with perioperative regimens. Individualized decisions needed to avoid over-therapy. That's in a nutshell the findings of this paper. Eponyms related to lung cancer: Wilhelm Röntgen discovered X-rays and revolutionized lung imaging. Henry Pancoast described superior sulcus Pancoast tumors in apical lung cancer. Montagu Bloom and W. Richardson developed the Bloom-Richardson grading for tumor histopathology. Russell Brock pioneered pulmonary resection techniques in early thoracic surgery. Santiago Cajal was a Nobel laureate who was involved in the checkpoint biology. Dorothy Reed Mendenhall and Carl Sternberg identified Reed-Sternberg cells in lymphoma, parallels in tumor immune evasion. David Bloom, Bloom syndrome, genetic instability linked to cancer risk including lung cancer. Benjamin Gompertz described tumor growth kinetics of the Gompertzian growth curve. Kui Ting Lan and David D. Metz developed they created the alpha spending function for interim trial analysis in oncology studies. Peter O'Brien and Thomas Fleming developed the O'Brien-Fleming boundaries for trial stopping rules. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by Master MedFacts at mastermedfacts.com.